Module 1, Initial Assessment Introduction. In this module, we'll focus on performing the initial assessment, a crucial step before commencing CPR. It's essential to understand that this module does not require hands-on practice. However, mastering the initial assessment is the vital part before moving into the following module. Your instructor will provide time to perform the skill before beginning the chest compressions on the mannequin. Let's begin with some best practices. All personnel involved in high-performance CPR must be trained and assigned a specific role within the pit crew model for efficiency and effectiveness. Upon arriving at the scene, rescuers should only bring in the essential equipment for resuscitation. This typically includes a defibrillator, airway equipment, and a medication box. It's important to avoid delays caused by unnecessary equipment handling, as this can postpone the assessment and subsequent compressions. The stretcher management, as an example, often increases the delay and time to performing the first chest compressions. In scenarios requiring two-person response, here's how to manage the equipment. Position 1. The first provider should carry the medication box in their right hand and the airway bag in their left. Upon reaching the patient's right side, they will place the med box near the patient's right legs and the airway bag above the right shoulder, adhering to the recommended gear placement strategy. Position 2. The second provider is responsible for the defibrillator, placing it above the patient's left shoulder. For responses involving 3 persons or operations in confined spaces, adjustments will be covered later in the series. The assessment begins with Position 1 employing a hover technique over the patient's chest, signaling readiness to start compressions. Meanwhile, Position 2 checks for a pulse and scans for any conclusive signs of death, such as stiffness in the jaw or fingers, which can quickly indicate whether resuscitation should be proceeded. The absence of a pulse or conclusive signs of death will prompt the immediate initiation of CPR.
No pulse, start CPR.
This process should be executed as swiftly as possible to minimize the delay in starting chest compressions. Performing a rapid initial assessment is the foundational part of high-performance CPR. Setting the stage for effective intervention as we move forward, remember the principles of speed and precision in this and every action you take. Pauses reduce the likelihood of survival with good brain function.